This is the Mechanical Care Forum, episode 402. It's the conclusion of season 13, where we've highlighted the McKenzie Institute International's Diploma program. Today we're connecting with a couple of groups of clinicians, a pair who completed this about 10 years ago, and once more with my cohort. We'll hear their big picture take on the program and specifically the benefits of the community with which they're now a part. This week on MCF. Hey everyone, and welcome back. Thanks for joining us today as we continue to explore the McKenzie Institute's International's Diploma program. This season, season 13 of the podcast. This episode is brought to you by the McKenzie Institute International. The McKenzie method of mechanical diagnosis and therapy is globally recognized as a leading treatment for back, neck, and extremity disorders. Personally, the MDT has made the single greatest positive influence on my practice, hands down. The McKenzie Institute International offers this diploma program to those professionals who've achieved prior certification in the method. It's the pinnacle of MDT training. Successfully completing the diploma program will place you amongst the world's elite in mechanical diagnosis and therapy. If you're interested in learning more, be sure to follow us along and go back and listen to any of the episodes that you might have missed from season 13. And secondly, be sure to go to the website to learn more about the program and how to apply. You'll find that by going to McKenzieInstitute.org and clicking on the Education tab and scrolling down to International Diploma. So you'll know if you've kept up with this season, season 13, we've walked through it over an entire year of exploring this program, of which I've had the opportunity to take part in. Today we'll discuss the long-term benefits which diplomats have at their disposal. This community of highly trained experts in musculoskeletal care in MDT. You'll hear from Fiona McKenzie and Sharon Finkelbrand, two diplomats as of about 10 years ago, and now faculty in Canada and probationary faculty in Mexico. They'll give you a feel of how the program continues to give long after the program itself is over, through opportunities and the relationships made in the program itself. We'll also hear from some familiar faces and voices in the cohort I was in beginning last year in 2023. They share what it means to have a group of peers with a similar goal and who are highly motivated above the average. Some expected benefits and some a bit unexpected. Don't forget, we'll share all these videos on our YouTube channel, which offers that visual element as well. So if you want to check out that, head over to YouTube and search my channel, Mechanical Care Forum, of course. Do stay with us through the end to hear what's coming down the pipeline of future episodes, which we're working on now. So here we go. First up, we'll reconnect once more with Emily, Tina, Tim, and today we'll be joined by Renaud. This comes from one of our study groups in preparation for the final exam, and we discuss this idea of having a community and a network of peers, which we've gained from and what that means to them. So here it is, our final episode of season 13, episode 402. Enjoy. So we just got through discussing for the past hour plus, a little bit of study session as we've been doing, as has been our pattern, at least several within our cohort. So welcome to this short discussion, Tina and Emily and Tim and Renaud. Renaud, mention briefly, if you don't mind, a little bit about where you are and your practice.
I live in the south of France and I work in a private practice, a small private practice where we are 3 physio. And one of my colleagues is working with MDT, and the other is not.
Excellent. And you were in the 2022 cohort, the theoretical.
Yeah, exactly.
And you did your clinical placement in France.
Yes, I did that in 2023 in France. Yeah.
Excellent. And you're preparing like everyone else here for the exams coming up in a couple of months. So
Yeah.
Excited to have you along. Thanks for being willing to chat for a minute. So the idea that we wanted to convey toward the end of this whole series, kind of highlighting this diploma program, which you guys have helped me with through just talking through the theoretical and the clinical placement, and then just in general, is that not only do we gain from the program itself, but we gain a group of individuals networking, whether we like it or not. Now we're stuck with Tim from this point forward, right? As I'm kidding, Tim. But just that now we have a group of people that we can talk about cases or touch base or just share what's going on in terms of our career and just the development professionally as we go on from this point, once we've completed this and achieved this designation. Tina, what's this group meant to you, and what do these conversations and the network of other clinicians who think similarly, use similar classification system, how is that valuable to you in
No,
your career?
I think for me personally, it's so nice to talk to someone that has got the same knowledge as I do by now, and it's just nice being able to talk to someone who is going through the same. I mean, they understand that we have to work our butt off to, just to keep on track with all those articles every week. So it's really nice for me meeting with people that are just into the same.
Hmm. Yeah. And whether it be just touching base about where we are and certain studies and the actual didactic work that we've worked on, or it's perhaps just sharing a case. Emily, we just got through talking about a case of yours with a patient that was seen by a colleague, then brought to you. You're trying to decipher through. How is that helpful to you, like practically speaking?
Well, especially for me, I don't have a lot of colleagues here that are MDT trained or even approach things with an MDT mindset. So to get help with a case, I have nowhere else to turn. Not that I'm just stuck with you guys, but if I get stuck, I can't just turn to a colleague, no matter how experienced they are. It doesn't help me problem solve through the mechanical track that I'm on. So the knowledge that this group brings to my table is so valuable because they know the steps that I've been through. They know what I've already done probably, and kind of where I might be missing something or maybe forgot to think about. They're like-minded, and I
Yeah.
don't live in a sea of like-minded people.
Yep. Yep. And that's what we hear so commonly from a lot of us all out here on our own MDT islands, wherever we are. So certainly I think that resonates with a lot of people. If you think about the clinical case that you presented to us just a little bit ago about a patient who's got right knee pain, but a diffuse kind of whole leg, right and left side, been going on for a while, a previous clinician working with the mindset that perhaps extension was the answer, yet you didn't see the same thing. What from our discussion today changes your mind or helps you kind of sort out, I didn't think about that, or just maybe it just reinforces that, no, I'm headed in the right direction?
I think it mostly reinforces, but even looking back at myself, I don't know, 15 years ago, I didn't do things the right way MDT wise. I was certified, I passed the exam, but I'm sure it's a different level of thinking. I would have approached it differently, whereas now it's a whole nother level, and there are things like mechanically unresponsive that just they weren't around in our definition years ago. Um, yeah, I would say this group just again reminds you of things that maybe you could have done more thoroughly, that maybe you did not and should have. But a clinician that hasn't gone through this much training would never have quite gone to this level of thinking and assessing a patient like we do. So I would say, to kind of answer your question, it helps to reinforce that yes, I'm kind of doing the right track, but also, hey, did you cut a corner? Or maybe could you have done X, Y, or Z a little more thoroughly before assuming something?
Hmm. Yeah. Tim, your career since we've even started this has made a significant change. You're now with someone who's going to give you quite a bit of mentoring, working with Todd. And so you're going to get this kind of stuff on an ongoing basis. However, in the midst of the clinic, we can be right beside the most well-educated and experienced MDT clinician. And just from the busyness of the day, maybe we need to set aside a Saturday morning or a Friday evening or whatever to where we just sit down and think retrospectively, or we talk about studies that have come out. How does it differ in your mind from being next to somebody through the day and then having something where we maybe perhaps get together and just have a network of people that you can talk at a convenient time later?
How does it differ between having both options? Is that what you're asking?
Yeah, I mean, is there any difference in or is it enough to have somebody just in the clinic beside you?
No, I think there's a lot of value in that because, even with having someone, on faculty around, it's still really important because we can get caught up in our own world, in our own kind of thought processes too. And then I think it's pretty valuable that, we've got a community of people who are trained in a similar way that might have a different perspective on things outside of our own clinic. So I think there's a lot of value in that. So we can all kind of stay up to date and not get caught up on our own, get off the rails or off track a little bit. So it's nice to have a fresh perspective with someone who you're not working with day to day, but are trained in a similar way. So, you're talking about the same presentation of patient, or, did I classify this incorrectly, or maybe I just missed something. So yeah, I think there's a lot of value in having the community with that.
Can I add to that?
Yeah, go ahead, Emily.
I mean, I mentioned before that, of course, we're all like-minded and we don't have that same network where we work. But the other amazing thing of this group is everybody is extremely motivated, and they go above and beyond because they're the kind of people they are. They're willing to talk to you on a Saturday morning when they could be doing anything else. And that's hard to come by sometimes. Like even where I work, I have a question about a patient and I message the doctor. They're never going to get back to me. I'm never going to get the chance to talk to them and talk about a case and collaborate, because some people just aren't collaborators. They do their thing, they punch and they punch out. But these people that are part of this network that we have, they're amazing and they're like-minded, but they go above and beyond. They're happy to discuss a case with you on WhatsApp at 11 o'clock at night, or get up at 6 o'clock on a Sunday morning to Zoom with everybody. So that's just the energy they bring to the group and the willingness to discuss and just really help each other. Not everybody does that.
Renaud, you have another clinician that you work with side by side quite often that you maybe have chance, but you had that even before starting the diploma program. However, when we embark on something like the diploma program, it necessitates that we take an additional level of commitment. Have you seen that this has caused you to be thinking a bit more thoughtful, or has your, I guess, interest and motivation to discuss with other MDT clinicians increased since starting this diploma program?
Yes, of course, because as Emily was saying, I also have this feeling that I'm getting much and better than I was. So I'm more willing to discuss with somebody because I know more and I have much more to discuss about. So yeah, I'm pretty sure the diploma helped me in this way. Yeah.
I just feel like.
Can I add to that, Jason?
Yeah, please do, Tina. Yeah.
Yeah, because when I went through the theoretical and also the practical, well, I didn't really feel that I was reaching the diploma level, but it's coming to me in smaller portions now that I feel closer to be a dip now than I have ever done before. Because just by reading everyday articles and discussing with you and all that stuff, being more wise now.
Yeah, I just think that the increased demands necessitate, if we're going to see this through to achieving this designation, it by definition or by the nature of it is going to demand that we increase our thoughtfulness and our clinical reasoning, which almost brings on a willingness and a confidence that we don't mind, presenting a case that we're a bit stumbling on, not because, anything we're doing wrong, but we just recognize that having some outside thoughts can clarify, can reinforce, can kind of redirect us. So, yeah. Well, I appreciate you guys going through this whole thing aside from the actual work and being willing to chat and just convey the ideas that I think the diploma offers for us all. Thanks for letting me slip this in our study session today.
Sure.
Definitely.
And to support the idea that once one goes through the program, the relationships which one gains continues to be a benefit long after the program is over. Fiona and Sharon explain how they continue to benefit. Here's the remainder of episode 402. So a big welcome back to the podcast, both to you, Fiona, and you, Sharon. Fiona McKenzie and Sharon Finkelbrand, thank you guys both for joining the podcast and joining me today to talk a little bit about this diploma program community.
Thanks for having us, Jason. We always speak at the same time.
Just like sisters. Yeah.
We become
Very good.
connected.
That's right. All right. Excellent. Right on cue, too, in light of our topic today. So, ladies, we're going to let you guys help us understand. The idea here is that those in this 2023 cohort that listeners have heard all through their experience through the theoretical and the clinical and the exam prep and the exam itself, and now beyond, just through this program to get an idea of the program itself, but also the benefits of it, not just during and not just up to the end, but beyond. And that's our point today to talk about. But before we jump into those topics, Sharon, why don't you give us first a little bit about yourself, where you are, and what you do professionally?
I'm Sharon Finkelbrand. I'm from Mexico. I live in Mexico City, and I have my own clinic. I just opened a new one, bigger than before, which is great thanks to MDT. I partnered up with another clinician who went through the diploma program, who's also Mexican. We are the only 2 Mexicans who have undergone that program. So we're very proud and very excited about it. And that's what I do.
And you're also involved in some teaching probationary faculty, right?
Yes. I am now in probationary faculty, about to finish with my last course in April. And I hope soon to be instructor for parts A and B.
That's very exciting. And I did see photos and videos of you in your new clinic, which looks very fancy, very beautiful.
Thank you. We put a lot of effort and love to it.
Yes, I'm sure. Excellent. And Fiona, tell us a little bit about where you are and all your responsibilities.
So I'm in a town called East Gwillimbury, which is about 45 minutes north of Toronto. And I did my diploma in 2014 with Sharon and contested the exam with her in St. Louis the next year in 2015. And since then, I now just work in private practice between 2 different clinics. And I also am one of the newer teaching faculty for the McKenzie Institute Canada. So I've just been promoted to teaching A, B, C, and D courses now. Mm-hmm.
Wow, excellent. You guys are just making your way in your own.
I'm very proud of her.
Yes, respective countries. Excellent. So one of the reasons why I wanted you to is because there's many maybe who have seen you guys on that video several years ago, just talking about the diploma program. And so it's almost like we'll catch you a few years later. Now, how's it going? And you're still attached.
Yes.
And so,
Yes, we are.
yeah, and that's the point of our discussion today. I want you guys to take us back first before you get into what you're doing now and how it still gives back. Tell us a bit about your journey up to what prompted you to want to even do the diploma program in the first place. Sharon, why don't you start?
So I first started doing McKenzie because of a friend who brought the McKenzie courses to Mexico. So I took part A with Mark Miller, and I just became in love with him and with the McKenzie method because he was an amazing teacher and so funny. So I started my journey, and then there was a time when I stopped because of personal reasons and professional reasons. And then, I don't know, maybe something bugged me to come back. I came back and finished my credentialing process, and I got really excited about it. And I said, I want to do the diploma program because I want to improve. So it took me a few years to gather the money and be ready. And that's why I applied.
Mm-hmm.
Excellent. Yeah. And Fiona, how about yours? Tell us about your interest in it and what prompted you.
I was studying for my credentialing exam with a group, and I asked one of my colleagues at work, who was a retired McKenzie faculty, her name is Ricky Yamada. I said, could you test me on a couple things? I just want to make sure my hand position's okay. And she also happened to be my boss. So she would make me a little nervous to replicate the exam scenario. And the feedback that Ricky gave me on some of the procedures or just some of the clinical reasoning when I had questions for her really made me think, I thought I knew a lot going into this credentialing exam, but there's a heck of a lot more. It's kind of like the tip of the iceberg. And she, I would have to say, single-handedly pushed me in that direction. And then I, at the time, had a discussion with Richard about, how do you go about this? And would I be good to do this? And would I be the right person? And then Richard just said, the least you can do is try. And he suggested to do it in the scenario where I was, where, I didn't have any children, extra things to worry about, that I could just go and focus on my studies. So it made sense to go at that time.
Mm-hmm. Yeah. Yeah. We hear that so often, that there's usually one or two few people that are that voice in our ear that continues to encourage us to press on with more. Great. So what about through the theoretical, through that first learning process? Now, we know that the program is ever evolving and it's improving, year by year. And so yours maybe have been different than what we're getting now and what we just received this past year. And as it goes on, I'm sure it'll evolve even more. But talk to us a little bit about what you gained, not just strictly from the actual content and the process of studying, but just that collegial relationship in the theoretical. Fiona, start with us for that question.
Well, I gained very simply a friend through multiple bars of chocolate and multiple bowls of popcorn being shared, sometimes during stressful moments, sometimes during relaxed moments. But Sharon being there, in all honesty, was a great person to run questions by when your mentors are busy with their own caseloads, or they weren't always available outside of the clinical hours to be able to ask someone something. And Sharon was so open and so friendly. It was really easy to have just someone to run things by and have somebody share the process with. And that was really, really helpful for me.
Mm-hmm. Sharon, what about you?
Since I was one of the only 2 clinicians credentialed in Mexico, I only thought about McKenzie being mechanical. So when I entered the diploma program first, I got to know that there is many people in the world trying to become diplomats. There are many MDT clinicians. I gained a lot of friends, especially Fiona. I remember when the teachers asked a question, she was the first to answer everything with all the, she was referencing and having everything done. I'm like, how in the world is she so fast? When does she have time to read? She was amazing. She had all the information ready. She read everything. And like she said, when I had to talk to someone, I talked to her because I said, wow, she knows a lot. So having someone to share things, and I was very, very happy that we had to share the clinical component together too.
Sure. We'll talk more about that in just a moment. A lot of people that when you hear them get into a group like this, there's discussions just like you guys were talking about. And before that, maybe they have a mentor like Ricky for you, Fiona, and your partner perhaps for you, Sharon. But outside of that, many people don't have that person. And so they really do feel like they crave some like-minded clinician that will use the same language and talk about patient cases. Now, outside of you, we know you guys are like, twins here and joined at the hip, but are there others that were in your cohort that you stay in touch with and that occasionally there's some opportunity to discuss professional topics? Either of you on that one?
To me, in the beginning, there wasn't anybody. I was one of the only 2 credentialed, and I was credentialed first. Mm-hmm. So neither of us knew like a lot of McKenzie. So I never had any mentoring or anyone to talk about it until I entered the diploma program. And that makes your name gets more known. So you get to meet more clinicians. Mm. And that's when I started talking to the people in my group and started talking to people that I met in some other courses or that worked with another instructors that were already diplomats, helping, discussing things, discussing cases. So that was very helpful for me, getting to know people in other parts of the world that I can talk to and ask questions.
Mm-hmm. Fiona, did you see a similar type of contrast of before the diploma program?
Oh, yeah. I was exactly the same as Sharon. And that's probably why we were drawn to one another so quickly, is we kind of worked in isolation. Like I had Ricky as a mentor, but she was purely administrative. She wasn't a clinical mentor. So when we went through the diploma program, I mean, we, in our cohort, like I still email one of my colleagues, she was in class with Sharon, Lieve Moyert from Belgium. I have never met Lieve. But every few months we send pictures of family, life events. We talked, like, I cannot wait to meet her in person. And just, I already know her kids' names. I know her wife, like I know everything about her, and I'm just really excited to meet her. And then even prior to this upcoming conference, previous conferences, Sharon and I arranged, we're a bit of the social committee in our diplomat year. We arranged with whoever was available to go out for dinner. Sharon, we had people from Brazil. Who else did we have at the table? You had me.
Jerry from the US, Corina from Brazil, Vicente also from Brazil, and Gabriela. I think you and me, and I think that was it.
Yeah, and so we try to keep a little bit of a connection. And if we see anybody that we know, after hours, after the lectures are over, we're always connecting. We connected with Max and Christian from Germany one year when we were in Miami as well. So we still keep in touch. And it's like you just pick up where you left off.
Yeah.
And you know what? Also, by being the only diplomat at that time, going to the conference by myself, because I was the only Mexican going to the conferences, I think of MDT as like a big family. Once you become a diplomat, you are part of that family. So I never, ever felt alone. I have friends all over, and I never felt like, oh, I'm the only Mexican, I'm going to be left out. Like, they're always so welcoming, and I always feel like we all share something that connects us.
Yeah, I know that you guys and your social prowess. I know it makes total sense that you would be that social committee. Tell me about. Can you think? And I haven't prompted you on this, but I'm interested to know. Have you had occasions where you got a patient and you're just wanting to bounce the idea off? Can you think of an actual illustration, an actual example where you had maybe an actual patient that you were wanting to just kind of bounce the idea off of either two of you from one to the other or someone else in your network?
All the time.
Yeah.
So Sharon and I do it quite regularly. I've done it with other faculty. I've done it with other diplomats. We also had a mentor when Sharon and I were studying for our exam. We went down to Tallahassee, Florida. Mark Miller hosted us, and Kevin Jones was an added mentor for us. And we would often send him questions, and he would be so open to providing, insight for us. He was great.
I talked to Kevin a lot of times too, like many times. He's just always open to answer my questions. And when I get stuck, I either call Fiona or Kevin, and they're always ready to answer things. And we've been patients to each other, Fiona and myself too.
Yes. Oh, have you? About, hey, I've got the shoulder issue. Help me out.
Yeah.
It's really difficult to think of yourself when you are the patient, at least to me. It's like I can't reason when I'm the patient.
Yes.
It is hard to distinguish and separate yourself from that problem. What about an actual case? And don't go into everything, but just give us an idea of what you were asking about. Was it trying to decipher a piece of the history, or was it a physical exam aspect, or was it something more?
I can tell you one that I presented to the McKenzie branch faculty just recently.
Yeah, sure.
And I was concerned about a patient that had passed all the special questions in the history. But her physical exam and her repeated movement testing didn't show any directional preference. And so that prompted me to go back to that history. And then I asked more questions. I was like, something else is going on here. And I presented that to them. And they gave me some added things to look at, look a little bit further. It was a lumbar patient, by the way, or so I thought. And then, we thought, well, could this be something like Dee Woo might have some input on, and that it could have been more of a gynecological presentation, or could it be more thoracic? Did you explore there? So I was able to say, I've done this, I've done that, I've done this, I've done this. So you get reinforcement that you've done a good amount of it correctly, but then you get reminded of certain things. When you present a case, you're like, oh, I never checked that. Probably should have done that when you present it to them. And then they'll give you added feedback of what you could do next. And in the end, it turns out that everything that everybody else would have tried, they all agreed she needed an onward referral. And she's currently awaiting a pelvic ultrasound to see if there's something else internal.
Yeah, but isn't that interesting? Because I know that there's someone out there listening right now who's thinking, I don't want to put myself out there and then to be exposed that I missed or made a mistake. What would you say to that thought?
I kind of feel like they're learning opportunities rather than mistakes. I mean, a mistake would be, to miss something obvious, or, but I was doing my best job for this patient in asking more information. And honestly, when you're through the diploma program, you can handle any kind of constructive criticism, and you should be open to asking more questions, questioning yourself, having self-reflection. So if you're not doing that, then I would be more concerned.
Yeah. Sharon, what about you? If you want to give us an example, can you think of maybe a case that you presented or reached out to Kevin about?
Well, I've shared many cases with Kevin or Fiona or Colin also, but it comes to my mind one time that I had a patient who thought it was a shoulder problem.
Mm-hmm.
His doctor told him he needed surgery for his rotator cuff.
Mm-hmm.
And I knew it was a neck because I moved him and moved him and moved him from the neck, and he kept getting better and better and better. But his MRI said, you have a rotator cuff tear. And to me, it was very difficult. Like, how am I going to explain to him that he doesn't need surgery? Like, I had many questions mechanically to many cases, but in that specific case, I had to ask Kevin, like, how do you manage this? Because how do you explain that his doctor is mistaken? His doctor sends me patients, so he's going to stop sending me my caseload. Like, how can I explain that to the patient and make him realize that he doesn't need surgery? He's getting better with neck movements. That was one of the patients I had to share.
Yeah, and that's a really great example, because it's sometimes just this communication aspect that we were trying to sort out. And those who've been around the block a time or two, like Kevin, he's probably handled that multiple times, and so he's seen some ways to be careful about it and show in a respectful way to that doctor, but yet not compromise our beliefs and our thoughts about, hey, look, we have some clear evidence here that rotator cuff that definitely shows to be torn on the MRI, yet it's responding to this movement. So really good example. And I think it just reinforces to have mentors, to have those out there that are alongside and being willing to discuss these cases is pretty valuable. What other ways do you guys see that this community of diplomats, once gotten through and achieved this level, does it lend opportunities? Does it position you in a way that you wouldn't otherwise have been positioned to, develop your career further? Fiona, I know you have some ideas about that.
Yeah, so for me, it opened a lot of opportunities, even during the 2-year period after my diploma, while you're awaiting to consider whether you want to go on further for faculty or not. Our branch administrator, Aileen, she was offering me the opportunity to assist with webinars, workshops, to assist on courses with some of the faculty. And again, you get more learning there too, and assisting with conferences, any type of thing like that. So I found that I didn't expect it. And it wasn't something that was, let's say, advertised if you had a manual of like what happens next, but it was a really nice bonus to have. And even now that I'm part of the faculty, I've come up with a couple things, because I'm a bit of a keener, then that puts it lightly, but we'll go like that. But I have put together with the McKenzie Institute Canada an idea. I said, we don't get to see each other other than at conferences. So it's a bit of my social coordinator and my academic self coming together. And I said, what if we just share, kind of like Sunday dinner, our highs and our lows of, the first 6 months of the year, or interesting cases, could we put them together? And I was a little afraid to ask because it had never been done before, but to my surprise, people said yes. And they all agreed on twice a year that we do that. So outside of conferences, we have a little bit of a connection within our own branch. And the first one that we had in January, everybody gave some good feedback from it. So I was really excited for that.
Yeah, well, way to initiate something like that. Usually when you do that, they say, okay, you're the one that's going to lead it now that you've
Well, that did happen. That I know I need to sit on my hands sometimes. So, but this one I was happy to help out with.
Yeah. Sharon, you've gone through now almost all of the probationary period and teaching courses. Tell us about that. How was that for you? Piece of cake, no problem, or otherwise?
Oh, not at all. No piece of cake at all. I started in January 2020, my first course. I went to Chicago, did it in English. So for me, I just become too nervous when I have to speak publicly in another language. If it's Spanish, I can speak all day long. I never stop.
Yeah.
I'm all nonsense. But if it's in another language that I have to speak in public, I just get too nervous and I lose my English. So the first time I did an awful job. Thank God Jane was such a sweetheart. And she had only constructive criticism for me. And she said, oh, you're doing great. You're filling the form amazing. You missed this, but you did this great. So she was a great mentor. So the pandemic hit, so I had to stop.
Mm-hmm.
And then afterwards, when I started like resuming my teaching process, I got the opportunity to teach with Scott, with Colin, with Robert Metcalf, with Richard, with Jose. So each and every one of them is different in their way of teaching, in their way of like interacting with students, in the way that they want things get done.
Mm-hmm.
So like the McKenzie Institute has done like an amazing effort for me. They have let me go to Costa Rica, teach in Mexico, like in Spanish speaking countries, and also in the US, because that's not something that they do all the time. But that shows that they want us diplomats grow in our journeys, because they opened a new way of probationary that wasn't before, because there is no one in Mexico who can teach me. So they were very open. So I've been teaching all over. So it wasn't easy. There's been a lot of difficult times, and there has been a lot of times when they tell me, you know what, you messed this up. There was that one time that I was seeing a patient in a course, giving my back to the public for 1 hour, talking to the patient. I never realized that. I was just facing the patient. My back was turning to the public, and the instructor said, like, Sharon, you have to turn. All those little details that you forget, because you are used to seeing patients in the clinic, but you're not used to teaching how you do it. And also, that like in the McKenzie courses, when you're teaching, it is not expected that you fix everyone. It is expected for you to show how to do an accurate history taking and an accurate assessment. But for the public, they want to see things work. So if there is someone that's mechanically inconclusive, MURS, chronic pain syndrome, and things are not a derangement, people start getting crazy.
Mm-hmm.
So you have to be ready to explain why is it a good thing that even though you're not fixing the patient, you are doing an amazing job on classifying.
Sure.
So it's not been an easy journey, but I wouldn't change it for anything. I love it. I've had so many great mentors.
Yeah, it sounds like it for sure. Now, we all know that there's maybe 1 out of 4 diplomats who might have currently be involved in teaching. So it's not meant that all diplomats are going to be faculty or even should be faculty, but we know there's other opportunities. And one thing that I know Helen and Richard have worked on diligently in recent years is to develop this diploma community and having some ongoing Zoom sessions. Fiona, you were just involved in one here recently, I know, and you made a comment. Do you care to just maybe let people know what that meeting was like and then what your take was from it?
So Michael Post was the presenter alongside the MDT Diplomat Member Committee. And this is something that didn't even exist when Sharon and I were going through. Like, Jason, your forum and the case conversations are what helped me study for the exam. But now there are so many more different things out there, and this is one of them. And as soon as they said, would you be interested? I don't care if I'm faculty now. I'm still learning. There's still more to learn. I don't think I'll ever think that I know enough. Do you know what I mean?
Mm-hmm.
And Michael presented his paper, and in his paper, he was quite open for us to ask questions about things. And it wasn't, again, it was not critical. It was just, how come you thought about that? And what made you choose to go that way instead of this way? Or why did you choose this instead of that? And it was really open, and it was just high level thinking, which is where you kind of need to be when you want to keep up those sharp diplomat skills. Because you think, to be a diplomat, we have to kind of, just be more in tune and precise with how we do things. And it just helps to share those thoughts with other people. And I really enjoyed it. I'll still keep attending those. I really liked it.
Yeah. I know that they've worked hard to do that, and they've got some really interesting topics. So that I think is just an added benefit. And whether it's teaching or whether it's just being involved or in these little ancillary projects, just like you've talked about being involved with Fiona, doing that twice a year thing in Canada, I just think that when you stick your neck out there and take the courageous step to go through the program, things come back to you and are just offered as opportunities. Any other thoughts, ladies, before we wrap it up today? I really appreciate you guys kind of walking us through your evolution of your career and then how it's evolved even since the diploma program. Have I forgotten anything? What would you say?
I would like
maybe
to add something.
Yeah, please do.
That also going to the diploma program is like everyone around you wants you to get better, wants you to improve. Even if they're not teaching you or mentoring you, it's like you have a community. When you need something, you can reach anyone that's above you or knows more than you, because there's always someone that knows better, and they're always willing to help, always willing to like make you better. There is no competition like, oh, I'm a better diplomat than Fiona, or she's a better, like, I want her to be an amazing clinician and she wants me to be a great clinician too. So if I have some questions, she will help me, I will help her. I've had sessions with Colin Davis teaching me how to teach things like in Zoom. So they're always wanting to make you better. That's the community type of thing that I just take out of this.
Yeah, excellent. Yeah, go ahead.
The only
Fiona.
thing I think that we need is that group on Schoology. Right now, our discussion board is kind of quiet. Do you know the LinkedIn MIUSA group that was there? That once upon a time used to be a hive of activity. It's kind of quietened down, but I think as diplomats, I think we should use that more and post things saying, I have a challenging patient. This is where I'd want to go next. And just, again, use it a little bit more as an open kind of forum to discuss cases. I think we could get more out of it, but as you said, it just takes a little bit of a leap. But just know there's no McKenzie police out there. And as Sharon said, it's a family wanting to help. And so if Sharon doesn't answer, someone is going to read it. And there are enough of us. That digital world, you don't have to worry, oh, am I asking too much? Someone else will be able to answer. And we all take our turns kind of helping one another. And I think we could do even more with that on Schoology.
Yeah, that's a great little charge for us all to be reminded and just to throw something out there, even if it's not really an exact case, but a scenario, or just, working with colleagues or dealing with admin issues or whatever it might be. Probably if we're having a challenge with it, someone else out there is also. So, ladies, thank you for sharing your journey. I knew a little bit about it, but I've learned some today, and I really appreciate you guys being willing to kind of talk about the community after the diploma program. So thanks for joining the podcast.
Thanks for having us.
Okay, so there you go with episode 402 and the conclusion of season 13. A very sincere thanks for those of you who stayed with me throughout. I've learned so much from the program. The evidence supporting and not supporting MDT, strategies for best management of the contractile dysfunction, an improved level of differential diagnosis with conditions like lumbar spine, SI joint, and hip, effectively and accurately ruling out the spine, a general increased confidence of knowing when to stay right where I am with a patient and when to move on, why and how to keep the communication with patients simple yet in a way which meets the patient's needs, the other classification, and the subgroups within and how to manage them, how to vet scientific papers and critically analyze the data. And possibly most of all, I've learned a greater sense of humility, realizing I've got plenty more to learn. If you've ruled out the idea that the diploma program is just unfeasible for you, reconsider. Perhaps it is, and I certainly don't know your situation, but you've watched a wide range of people just in my cohort who are younger and earlier in their career, to those like Tina and myself who've been in the field for more than 20 years. Some whose kids are grown and don't need mom and dad near as much, and others with 3 kids who are young and still quite dependent. Some who've gone through credentialing recently, and others who've completed that long ago and before the curriculum has developed to its current status. The point is, if you want to achieve it, it may not be out of reach like you might have been thinking it was. It's not easy, but not much which is truly worth it is. It's been a pleasure to facilitate an exploration of this program with a great group of people, and I hope you've enjoyed it too. Stay tuned for season 14 with a whole list of great guests on super relevant topics. That will be coming up soon. And don't forget to subscribe to my email updates to be notified of new episodes. You can do so by clicking on the sign-up bar at the top of my website. Subscribe to the podcast on your favorite podcast player and follow me on my social media channels, as well as be notified when each episode comes out. If you're hearing audio versions, don't forget that we are releasing video versions of the podcast on our YouTube channel. Again, we want to thank today's sponsor, the McKenzie Institute International, providing worldwide training and support to clinicians in the principles and practice of the McKenzie method for the management of patients with spinal and extremity disorders. The McKenzie Institute Diploma program provides the highest level of MDT training. It enables the clinician to acquire an in-depth understanding of the McKenzie method and become experts in its effective use in guiding their patients to achieve their personal goals. If you have an interest in learning more about the diploma program, check it out at McKenzieInstitute.org. And if you've heard enough and you're ready, you can apply to enroll in this program through McKenzieInstitute.org through October 31st of each year. By the way, if you're wishing you had more interaction with skilled and like-minded clinicians and researchers, we're continuing to plug away here at Mechanical Care Forum with new cases within Case Conversations, our patient case discussion resource, and with new scientific studies within Inside the Science, our peer-reviewed summary and discussion resource. Access to past, current, and newly added cases and scientific studies to assist you in having practice-impacting content for those who want to continue to go the extra mile to become better. These resources, Case Conversations, and Inside the Science, are intended to provide virtual mentoring for you and help keep you moving forward in your professional development. You can check out these at mechanicalcareforum.com. All right, I wish you a great week with your patients this week. Do what you can to better yourself professionally and gain a new community in the process. And join us right back here next episode for season 14 and more of sharing experience for improved patient care.